Hi, everybody. We're just about to
Hi.
get started. It's 4:31. We're going to give everybody a couple more minutes to join before we get going. My name is Phoenix. I work in communications at CBC Vancouver. I'm your moderator today. Again, we're just going to wait a couple more minutes and then we'll get started. So a few housekeeping things. When you came in, you would have seen that you are being recorded right now. So if you don't want to be recorded, or if you're a little bit camera shy, you can turn off your computer cameras. Otherwise, we'll likely be recording this, and parts of it will be used for our community town hall on March the 10th. And we'll likely be putting this video on YouTube as well, just so you're all aware ahead of time. And you also have all clicked and signed that waiver online. So we are almost ready to go. So we're just going to give people a couple more minutes and thank you for joining us. And then we also, if you have any technical issues, we do have somebody on hand that might be able to help you, though it's really your computer setup. You might be seeing technical support as a guest or a participant. So you can try to direct message them if you have questions. But we will get started shortly. Yeah.
It's so nice to see everybody like this. I'm seeing you guys on a very big screen. It's really nice to see so many people from, I'm guessing, all over the province.
Yes. Okay. Yes, technical support has written into that little box. If you have any technical issues, you can reach out and help. And we'll just wait another minute and then we'll get started, okay? In the meantime, I wish there was hold music. It's Zoom, but we don't have hold music.
We can sing or not. I'm not volunteering myself, just saying.
We could say where we come from in the province. That might be interesting.
Yeah, I mean, we can definitely, if we have time, we can go through that a little bit. We'll probably get started in 2 minutes. So John and Anne, where are you from in the province?
Surrey, Guildford area.
Perfect. Is anybody else? I see some friends on screen. Hi, Tanya, and hi, Michelle. Great. Okay. So we're just gonna get started going here. So if you are not on mute, if you could just put yourself on mute for the time being, and we will get going shortly. So my name is Phoenix, as I mentioned earlier. I am with CBC Vancouver Communications. I'm your moderator for today. You'll also see another moderator on screen. That's David. David will be helping in the comments and joining us as well. So thank you for attending our community conversation on the COVID-19 vaccine and Indigenous communities in BC. So today's session is really focused on the vaccine, the distribution, and communications for Indigenous communities and Indigenous people in British Columbia. We do have a town hall on the general vaccine rollout and the general vaccine questions on March the 10th. So if you have general questions like, like I have an allergy, will this work for me? I hold on to those questions for our March 10th town hall. Today's session, we really want to dive deep into some of the issues that are facing our Indigenous communities. So joining us is Dr. Shannon McDonald from the First Nation Health Authority. And we'll start off the day by having Angela and Shannon chat a little bit. And then after that, for kind of 15 minutes, we will have a little bit of a poll just to see where everybody is at on the vaccine and what your opinions are so far. And then we'll open up the floor to questions. Some of you are super keen and pre-submitted a bunch of questions. So Angela has those on hand as well. So if you go to the bottom of your screen, you'll see a reaction box. So on the bottom bar, so you can raise your hand in there to ask a question. If you don't have that option, because I know Zoom is different for everybody, you can wave to Angela during the Q&A, or you can type it into the chat and we will try our best to get through to everybody. Does that sound good, everybody? Give me a thumbs up. We're good. We're good. Good to go. All right. So I will leave this conversation to Dr. McDonald and Angela.
All right. Well, hi, everybody. Thanks for joining us in our CBC living room. Again, it's so nice to see all your faces unmasked safely. Haven't seen that for a long time. And thank you so much, Shannon McDonald, Interim Chief Medical Officer for the First Nations Health Authority. Thank you so much for joining us. And I'll just start off, Shannon, by asking you, how are you doing during this pandemic? What's this been like for you?
It has been probably one of the busiest times in my life, except when I had 3 kids under the age of 4. This is kind of in that same ballpark. And it has been a long journey. I mean, we started over a year ago now. Our first case was the last week of February last year. So it's been a long journey. There have been ups and downs, but hanging in there, happily calling in from First Nation on Vancouver Island, and very pleased to be able to be a guest on this territory and to work from home.
And I should say as well, I'm very honored to be here on Squamish, Tsleil-Waututh, and Musqueam territory. And first off, Shannon, I mean, we've reported this morning that more than 24,000 Indigenous communities, Indigenous people in remote and rural communities, more than 113 communities vaccinated. How would you describe and rate the vaccine rollout specifically in Indigenous communities thus far?
I have been so impressed with the involvement and engagement of communities in this. It has not been easy. The planning, the setting of priorities, knowing that every day we go out to vaccinate in one community, there's another community that we haven't made it to yet. So there's always that kind of in the background. We've been challenged by vaccine supply. You know, we really thought we'd be out in more communities on a given day. And because of weather, because of logistics, or just because of supply, we've had some challenges that way. But I've been very honored by people who are willing to tell their story about, on our website, we have the Vax Champions who are sending us pictures of getting vaccine and telling their story and encouraging their family and friends to do the same. It has been a bit of a challenge talking to people who are more hesitant, but more than willing to do that. That's my job, to give people trustworthy information so that they can make their own decision about whether or not to have the vaccine.
And on that note, we have seen some communication breakdowns throughout the vaccine rollout. We saw that in Newhawk territory where vaccine was taken away. They put that on the onus of communication errors. The community described it as them not being afforded the self-determination that all Indigenous people should have given UNDRIP and the rights that they have. Why do you think that this has been cumbersome in some communities, like in the Newhawk and other communities?
We're not doing this alone. The vaccine primarily comes from the provincial government and a system to get access to information through that piece. We work with our partners in the regional health authorities. Some of the communities, most of the communities up to this point, we have provided vaccine directly, but there have also been communities where either it was done in partnership, which was the case, for example, all over Vancouver Island. And in the case of Newhawk, it was the regional health authority that was bringing the vaccine. And there were missteps. Somebody who didn't have a lot of experience in working with our communities and who was not clear about his expectations and making sure that he and the community were on the same page before things got started. And that was sort of the beginning of a circle of issues. But this work is about relationships, and trusting relationships are so important. So we're learning every day, and hopefully communities are learning as well how to be really clear with what their expectations are, and that hopefully those conversations are happening before there's a needle in anybody's arm.
And on that note, you were just talking about building trust. Of course, we know from the provincial, the BC government, that there is racism in the healthcare, specifically against Indigenous people. In my reporting, I found that that's an added risk because Indigenous people, even if they have something as serious as COVID, might not go to the hospital because they fear the way that they may be treated. Throughout this process, throughout the vaccine rollout, as you've talked about, there's been issues with vaccine hesitancy, but in this very critical, sort of life and death time that we're in, how do you encourage Indigenous people to build trust in a healthcare system that has not been, where there's not been this positive relationship that we'd like to see?
I have been privileged in being able to go to community and talk to people. I've become a familiar face. We're doing a lot of work in webinars. There's a lot of work that's out in media, on Facebook. So people see my face and know my voice. And that's helpful. But as I said, it's about relationship. And many of the people that I've talked to, especially after we've done the first round, the first dose round in some communities, there were people that were reluctant at that time. They kind of wanted to stand back and watch and see what happened to their friends and family members who had taken the vaccine and are now approaching us to say, when are you coming back? Because I've thought about it and I've changed my mind. And I have to respect that. My job is to give the best information available, answer the questions as I can, and hopefully people are making a choice to be vaccinated, but I also have to respect if they don't. And that reciprocal relationship is key to being able to move forward in this.
I'm just wondering, because this kind of surprised me a lot, because I did hear, maybe not a lot, but I heard some concerns from Indigenous people who were vaccine hesitant for a variety of reasons, historical and just concerns again about things like, allergic reactions coming out of the UK. But I've seen a number of communities 80-90% vaccinated. I just went to the Katzie community. 81% of the community was vaccinated there. What do you attribute that to there being maybe not as much vaccine hesitancy as maybe there was at the beginning of the vaccine rollout?
Well, I think it says we're doing a good job so far, but that's not universal. We also have some communities where there's been more people hesitant than not, people who have had a strong reluctance to take vaccine generally, and have communicated that. So I don't want to say everybody is at 80% because they're not. Probably an average closer to 70 right across the board. But we have some that are more and some that are less.
I want to ask you a question that I think there's been confusion about a little bit, myself included. And that is, I remember when I first talked to you, probably even before vaccines started to roll out, and we were talking about when the vaccine came, who would get it? And you were saying, yeah, if there is somebody who's non-Indigenous, who's married in, or maybe they live nearby, you were telling me that you would vaccinate those people to make sure that the entire Indigenous community is protected. So right now, as it stands, we know that, those people, those Indigenous people, even status Indigenous people living in the city won't get vaccinated in the first phase that we're done with now. But will you be vaccinating, or will the province be vaccinating, for example, Indigenous people who are Musqueam band members who live near the reserve but off the reserve? How are you doing that? Because that seems kind of confusing to me.
It is confusing. When First Nations Health Authority has gone out in phase 1, especially to our remote communities, we went out with a all of community approach, as you talked about. Everybody that was in the community that wanted a vaccine got a vaccine. There was not one circumstance where we were left short in community. there are situations now that are a little more complex, and I'm glad Tanya is here as one of the guests. We've been having lots of conversations about the urban Indigenous population because we don't have, as FNHA, we don't have the direct service responsibility to provide vaccine to Indigenous people who live away from home. However, that's still a real sense of responsibility for us, that we want to help care for all of the family. And that's a message that we've gotten back really strongly from chiefs and leaders who don't perceive the reserve boundary as the boundary between service and not service. So we've had a lot of these conversations going forward, and Tanya is here from Métis Nation BC. She's been a part of the beginnings of those conversations, and we've also been engaged with the BC Association of Aboriginal Friendship Centers, and we've had lots of conversations ongoing with the regional health authorities about how they are going to service all of the population. At this point, we've been able to say, because of differences in health status, chronic disease rates, social determinants of health, limiting the initial vaccine off reserve to those 80 and above, the numbers are really low. And so we really want to make sure that we are providing to those most at risk, and have been able to convince the province to start at age 65 and above. And I suspect over time that will drop precipitously. The other thing that we're really conscious of is making sure that people have an accessible, safe, transportation-friendly, and culturally safe location to go and get their vaccine. So in the work that we're doing, we're hoping that where these mass vaccination clinics are being planned, where there may be 30 or 40 vaccinators in a stadium vaccinating at a time, that may not work for some of our population. Are there ways to design either that setting so that there are people being greeted at the door and walked through the process by First Nations Health Authority staff or others? Or is there an alternative location that is more culturally safe and friendly to the community members, where they would feel more comfortable? I've had one elder express to me a concern about using a church as a location for a vaccine distribution. Out of their own experience in the residential school system, they just were not willing to walk in the door. And that's not my experience. So I have a hard time understanding, but absolutely respect somebody saying they don't want to go into that particular location. So there are a lot of things to consider. There's a lot of work left to do, and time's running really quickly. So we continue to work with our partners on trying to get I'm trying to get crunchier about these things. We're talking about them, but I want to talk specifically to the details, and we haven't quite gotten there yet.
That's a question in terms of how do people access the vaccine living in the city. That's something I've heard a lot from people. You know, we've heard there may be friendship centers. I know you and I talked about that again at the very beginning. We've heard there's right now this number that people can call in, because now, of course, we're in phase 2. So it's Indigenous people in the city 65 and over can get their vaccine. How do they go about doing that if they're not connected to a doctor or a friendship center? And if they are connected to their doctor in the friendship center, can they go there and get that information?
I hope so. We have been working, some of you may be aware of our virtual Doctor of the Day program that was put into place at the beginning of the pandemic to increase access to online or telephone primary care. So we've had physicians who work within the region where they live, and answer calls and support people in that process to answer questions about whether or not somebody should get a vaccine, for example, a specific chronic disease or other things that they need to talk about. We have the First Nations Health Authority regional staff who are willing and able to help people to go through the process. And I'm sure there's other organizations that would support similarly to make that as available as possible. The call-in centers open next Monday. And they will be busy. The numbers are just, I think they've just been put out publicly. I've got sort of the embargoed copy, so I don't want to jump the gun on my ministry partners, but that number should be made available very quickly. And so people over the age of 90 in the non-Indigenous population and those over 65 in the Indigenous population can start calling on Monday. But if Ontario is any example and Alberta is any example, both of them had their systems crash on day one. So it could be a bit of a challenge getting through to get an appointment. But considering we didn't even think we were going to start getting vaccine until May of this year, I think we're well ahead of the game.
I want to move into a question that touches on some of the racism that Indigenous people have experienced throughout, not the beginning of the pandemic, because we saw that as well in terms of Indigenous communities that had outbreaks. But in terms of the vaccine rollout itself, I reported today about Nechako Lake's MLA, John Rustad, taking to Facebook to say, why isn't this community, a non-Indigenous community, right beside this Indigenous community being vaccinated? Why is this entire community being vaccinated age 18 and up, but not this non-Indigenous community? So I was hoping you could touch on that a little bit for people who are still grappling with this notion, why Indigenous people were in this first priority rollout.
The Indigenous people is being in the first priority rollout is a national priority. So we weren't the only ones that set that. In the province of BC, there was a split between what was given to the First Nations Health Authority to distribute and what was given to the regional health authorities to distribute. We set policy about providing vaccine, as I said, in an all of community approach, starting with the most remote and isolated communities. The first 10 communities were fly-in only nursing stations that received their vaccine just before New Year's. And then we've kind of gone from the outside in. In addition, we have been able to provide vaccine to communities that have had clusters or outbreaks. We understand the challenge. I can't imagine standing somewhere with my 18-year-old, I don't have an 18-year-old anymore, but by concept, and them getting a vaccine and my neighbor not, being an 80-year-old person. It's very challenging, but the way we set up our priority system and the way the province set up their priority system were different. And before some of those conflicts were resolved, we had the vaccine shortage. So where we still had a supply we hadn't distributed yet, so we were still able to distribute. Some of the health authorities had already utilized their full supply. So there were some of those potentials. But I think the other situations specific to some of the racism that arose were in communities where there was a perception that the First Nations were the cause or the transmitters of the virus. And part of that had to do with transparency around statistics. First Nations communities were letting people know that they had a number of cases in their community and were being very transparent about that, where the regional health authorities were not doing the same in all circumstances. So locally, there was an impression that all of the cases were on the First Nations community, which was of course false. In one health authority, a decision was made to actually be transparent about cases in the neighboring non-Indigenous community to try to balance some of that out and help people to understand that there were challenges in both directions.
All right. I think
So-
Phoenix is going to jump in.
Yeah, I'm just going to jump in because I know that there were a lot of questions ahead of time. So we're moving. This is like a really great conversation, and I'm learning so much. So I hopefully everybody on the line is learning as well. So if before we move into questions, maybe we'll warm everybody up a little bit. We have a few, like 1 or 2 polls. I'll put them up, and you can let us know how you feel so far. And while you're doing that, you can think about some questions you can ask Dr. McDonald, and Angela has your pre-submitted questions as well. So the first poll that we have is on a scale from 1 to 5, 1 being poor and 5 being excellent. How would you rate the vaccination rollout in BC in Indigenous community so far? So I'm going to launch that poll now, so you should see it. I'll give everybody a few minutes to answer, and if you don't want to answer, that's fine as well. But it would be nice to hear all of you and see what that's like, and we might take some of your answers and like take some of the results from this poll and you know, use it for the town hall. We don't know yet, but you know, your answers help guide us in our town hall.
While people are answering, Phoenix, do you want me to go through some of these pre-submitted questions?
Sounds good. That's perfect.
Yeah. Okay, so we have a pre-submitted question from an audience member for you, Shannon. If a reserve has 600 on reserve nation members, they are asking, doesn't it make sense to just vaccinate all at the same time?
That's what we've been trying to do. When we've had the supply, we have gone in with an all-of community approach. When we haven't and we've had to ration, there have been a few communities where we've gone in and done the 65 plus community members, and then we will go back again when the supply makes that possible to vaccinate the others.
All right, and I just want to remind the audience, if you have a question that you want to ask in person or virtually, just raise your hand. You can raise the hand icon or just put up your hand as well, or type the question here. And we have about, do we have 30 more minutes, Phoenix?
We have until 5:30. So
Until 5:30.
So
yeah.
tons of time. I also have, if you guys have time, a second question. Given what you know now so far, would you take the vaccine? So the question answers yes, no, unsure. And if you prefer not to answer, we've given that option as well. So we're launching that poll right now. And yeah, Angela, if you want to answer a question while people are answering.
Yes, yes. I still haven't gotten mine. I'm waiting for a phone call. Healthcare providers do have an advantage. We are in the phase 2, but because I don't directly deal with patients, I'll be at the end of phase 2. So I'm waiting for my vaccine as well.
Here's another question from the audience. Is there a priority to vaccinate Indigenous workers living and working in Vancouver and the Lower Mainland? I'm not sure exactly what type of workers they're referring to, but you're shaking your head, so I'm assuming you know what they're talking about.
At this point, unless they're healthcare workers, in which case through their workplace, they would be eligible for vaccination. There is consideration coming forward for police, fire, emergency medical technicians, and corrections coming forward, and some other groups in what's called conjugate settings where people might live together. So we're seeing some of the concerns that have come forward for treatment centers, for example, and staff in treatment centers to make sure that they're protected and thereby protecting the people they work with.
Here's a question from our audience now. I don't know if you can answer it, Shannon, but you can take a stab at it. When will the online vaccination registration for Fraser Health be made available?
All of the phone lines, all of the call centers open on Monday, March 8th, but you have to be in the correct age cohort. So
Right.
on Monday, it starts with 90-year-olds. And then I'm not sure how much later it becomes the 80-year-olds, and then it goes down by 5-year increments. So if you're my age, if you're 63 and you try to call in when it's supposed to be for 80-year-olds, then they will tell you you're not eligible to register at that time. So watch for, there will be lots of media, there will be lots of information out for people to be able to utilize the call centers. There's also an online registration, though knowing systems crashes when some of these big things happen. I don't know that I would be as confident of that in the first couple of days, but the first one's open on Monday.
And we have a comment from Julie, and this is something I've heard a lot of as well. The lack of information, she says, is driving my anxiety high. I live on a reserve, but not the one I am registered in. And both CHR say I cannot get vaccinated at either community. How do you explain something like this?
I'm really surprised by that. And if you wanted to send me a private message with a contact letting me know which communities, you don't need to put it up in the public chat. That's something we could help you deal with. A lot of people have been concerned about communication, and I steer a lot of people to our website, to fnha.ca. There's a lot of information on that website. There is video, there is documentation for people who are looking for more detailed information. There's a lot of community-based information as well. So I definitely welcome your visit to that website, and things like what we're doing today would also be posted on there once they're public, so that people have the opportunity to see and hear.
All right. This person is asking how many First Peoples, I'm assuming they mean First Nations peoples, have not recovered from the initial shots of their vaccine medication. Do we know, do we have those type of statistics?
We only have one individual that's documented as ending up in hospital after they've had their shot due to an allergic reaction, and they were in the emergency room for less than 24 hours and released. So we don't have anyone that has been hospitalized. I have not been informed of anybody having long-term serious effects from the vaccine.
Good to know. And do you have the updated numbers? I know this morning I looked, and again, it was, I think, just over 24,000 Indigenous people on reserve who've received their vaccine, their first and second doses.
Yeah, there's about, I don't know the exact balance, and I'd have to turn you guys off to look, because I usually get that report at the end of the day. But there was about 5,000 people who had already received their second dose, and a total of close to 24,000 people overall who have received vaccine.
All right. And do you have any questions on hand, Phoenix?
You mean in the chat? I don't really see anything that you haven't, but we do have some from pre-submitted ones that we can get into if you want to.
Yeah.
There was one about how are you working with Northern Health to address the lack of communication on the state of COVID-19 planning in Northern BC?
We partner with Northern Health, and they have worked with us on many of our community implementations. I don't have, one of our communications staff is actually on assignment to Northern Health right now to help them out a bit with that, but we share all of our communications resources. In fact, we've had the opportunity to share our communications resources not only across Canada, but across the United States as well, and New Zealand and Australia. They have all made use of some of the work that we've done. So there's lots of information that we share. And I have I see Dr. Kim, who is the chief medical officer, 3 times a week in meetings. And then we also have a once a week meeting with a whole team to talk about vaccine implementation. So we're very actively connected to them.
And this question actually ties into another question that somebody's asking now is, do you have any special plans for high risk people? I'm not sure if that's health risks or what, but maybe you have a better understanding of what they're talking about there.
At this point, we have not done that because we're doing a whole of community approach in most of the communities. We haven't singled out individuals that are at high risk. But when I sit with the chief medical officers, one of them has specifically taken on this as an issue and is bringing forward individuals to be prioritized. And this is something that can be done in conversation with your physician. There are very few situations, unfortunately, where somebody with a chronic disease that's relatively stable would be considered. There is some conversation happening now about individuals being vaccinated before they enter into hospital. I know that there have been very active immunization of individuals in long-term care facilities, and including people who are waiting in hospital to get into long-term care. So that there is a really active process to support those individuals and to try to keep them well. But we don't have a universal program for individuals who might be medically at risk, specifically at FNHA.
Right. On that note, we have a question from Julie asking, many of my American friends say that having as a high BMI is considered a condition that allows them to have a priority. Is that the case here?
Unfortunately, no. We do know, for example, just like individuals who have lung problems like COPD or asthma, people who have uncontrolled diabetes, and people who are overweight are at higher risk of complications of COVID. We're aware of that, but at this point, we don't have a program specifically to support prioritizing those people.
On that note, one of the questions I've heard a lot is that should certain people with previous health conditions, say multiple sclerosis, should they not be taking the vaccine? What do we know about those? I mean, you can't go through all the whole list of every condition, but for people that have serious health conditions, what are the sort of the rules around that?
I'm going to back up just a little bit from where you are. Early on, the manufacturers of the vaccine expressed caution about pregnant and breastfeeding women, as well as individuals who are immune suppressed. So I'll start with the pregnant and breastfeeding women. The Society of Obstetricians and Gynecologists of Canada have come out with a very strong statement saying the risk of COVID is much higher than the risk of a bad effect from the vaccine. There is no record of a baby being badly affected by vaccinating mom during pregnancy, and they have given women the green light to breastfeed, which is good news. With regard to chronic diseases, it's a little tougher because it is one of those case-by-case situations. There is no absolute contraindication of any disease to getting the vaccine, but if you are undergoing treatment for cancer and are on chemotherapy that significantly reduces your body's ability to mount an immune response, then it would be a conversation you should be having with your physician. Situations where people are taking a drug called methotrexate for rheumatoid arthritis or taking high-dose steroids for inflammatory disease, those are also drugs that can reduce your ability to mount an immune response. In most cases, doctors tell us, go ahead, Things are good. You may not get that 92% efficacy. You may get 75. And then over the weeks, the efficacy will increase as your body has a chance to catch up. So what we recommend to people is, if you're not sure, call your primary care provider and ask, because everybody's situation is going to be a little bit different.
All right. Before I get to the next pre-submitted question, I just want to make sure that I'm not missing anybody. Does anybody have a burning question they wanted to ask on camera right now? You can put your hand up so I can see. Nobody? I don't think anybody has the icon up either. No? All right, we'll just continue then. I have another question that's also a pre-submitted question, and I think you've already answered this, but I think this is a good question. This is with regards to communities with slow or no internet. Who and when will someone contact the public when it's their turn for the vaccine, especially for those living in communities with slow internet access, limited access to computers? But I think you've already told us that most people will be using that phone line if they're not sure where to go.
Yeah, that probably, but we have some communities where phone access is not so great either. So what we have recommended are some of our on community, like on First Nation community, if people don't have a phone or a computer and they haven't been able to access vaccine, I would suggest they go to the health center or other service center and try to utilize the community resources. But in urban settings, there may be people who don't have a cell phone, who don't, and God knows we couldn't find a payphone to save our life these days. That, you know, using local services as much as possible. Ask a friend. It's like we're on the $1 million question game, but there, you know, there are lots of opportunities. What isn't going to be available, unfortunately, is walk-ins, because there are going to be so many people having appointments at the same time, and the requirement for social distancing, because we don't want crowds of people outside the service centers. It's going to be very challenging. So they won't be accepting walk-ins. You're going to have an appointment.
Yeah. Okay. We have another question. This is about variants. So brace yourself, because I know we all have limited information about variants at this point, but this person asks, I'm interested to know what you, Shannon, know about the likelihood of a broad spectrum vaccine being developed in the future to combat variations of COVID-19 and other viruses.
I'm not magic.
I think we've heard, though, that this vaccine, from what we know so far from scientists, will take care of the variants.
So far, the variants. Yeah. Now, you have to understand that vaccines are like teenagers. They change their clothes to get good attention, right? 17 times a day. So they're constantly changing to try to have an advantage to be able to transmit better. They need human hosts. They don't have DNA. They need a human host to be able to replicate themselves like a teenager. So they're constantly changing. And all viruses are like that. That's why we have a different flu vaccine every year. Same thing, right? The influenza virus is mutating, and it's mutating differently in different places. Most of those mutations don't do anything. They don't work. They don't make the virus any more able to transmit to another person. They won't make anybody more sick, and they won't change how medications or vaccines work. However, now we have at least 3, the UK variant, the South Africa variant, and one from Brazil. So far, we've only got 3 cases of the Brazilian variant that has been recognized in all of Canada. So that's a good thing. And the tests that are done, this is a test for me because I just heard these this morning. The tests that are done on that, the vaccine is very effective. The UK variant and the South Africa variant, with both Pfizer and Moderna, there is a slight reduction. So from 92% efficacy down slightly to high 80s. So still very effective, but there has been a change, because what's changed is those spike proteins. If you've seen the picture of COVID, it's like a tennis ball with a bunch. It reminds me of, you know, those, we used to do it as kids, the oranges, and you poke the cloves in all over the place. That's basically what that virus looks like. And it's those spikes that have changed in the mutations. So at this point, what we've got is still effective.
All
But
right.
they are constantly being monitored. The National Medical Lab were presenting this morning at a national teleconference, and were giving us those details. So it left me feeling pretty confident. And with the AstraZeneca vaccine as well that's coming forward, it did really well in terms of efficacy as well against those variants.
And the next question I have is kind of two-pronged, because I'm going to preface it by asking a question that was asked of me by the KT First Nation leadership. And that is, they're really concerned about teenagers in their communities, saying this is a group of people who are high risk. And I believe from the research that I've done, Moderna is 18 plus, but Pfizer is actually 16 plus. They were told the night before that they would not get those 16 and 17-year-olds vaccinated. Can you explain to us why that was?
That was a supply issue.
Okay.
So the numbers that we were sending to communities were based on 90% of the 2019 census for adults 18 and over. Complicated formula. And we knew the 2019 census underestimates the actual on-reserve population, and then they were using 90% of that. So we were concerned that the vaccine that we were being given, we wouldn't have enough for those 16 to 18-year-olds. Now, what I'm confident of, there's studies going on right now with 12 to 18-year-olds that are going very well, but the manufacturers haven't come out yet and said, yes, go ahead. But I'm pretty confident that we'll be able to vaccinate adolescents at least in the next short while, probably the next few months.
And here's the pre-submitted question from our audience. There are many young adults with compromised medical issues, yet the COVID vaccination list does not provide clear guidelines as to where they fall in the mayhem for vaccination. When they call the COVID helpline, they get the runaround. How does the health ministry, plan on correcting this oversight?
Well, I can't speak for the health ministry. Those are decisions that are made with Dr. Bonnie Henry and the Premier and the Minister of Health. But I do know that there have been discussions about, as I said earlier, the one medical health officer who's working specifically on those high need populations, that is being brought forward, and I anticipate that we will see a decision about that soon.
Okay. The next question is, this is a question about somebody who's overseas. My son-in-law is here from Cancun and is waiting for his visa to be approved. He is 30. Can he get vaccinated? And if so, how will he be notified when it's time?
He has to be registered as a resident. So does he have a provincial health number? That would be an important piece of that. And 30-year-olds, sorry, are way down the pipe. If you start going from the 90 and 80-year-olds in the next couple of weeks, and then in 5-year increments, it will probably be summer before 30-year-olds are getting vaccinated.
And even, I think, in the urban Indigenous plan, I think it's 45-year-olds in April to June. That's what I've seen. Yeah. One more question. Will my home caregivers of seniors be eligible for vaccine along with their senior. My husband is 91 years old, limited mobility with a walker, and depends on me to shop, take care of our business, pay bills, etc., cook, clean. I am only 74 years of age. Can I get vaccinated when he does?
I don't
That's a good
think
question.
so. I don't think the partner can get vaccinated at the same time. I will tell you, I've got an inside track. My husband manages a home care unit, that most of his staff have now been vaccinated. They're getting calls on a daily basis. So home support and home care staff are among the healthcare providers that are being vaccinated. So I'm hoping that gives some reassurance. But at this point, that age criteria is being held to pretty strongly. So I'm afraid he or she will have to wait until their age cohort is called.
All right, so I just want to remind our audience that we do have about 8 to 9 minutes left. So if you have any burning questions, this is your time to ask. I only have a couple more questions left, so we are going to wrap up here pretty quickly. So please do with a hand, either a physical hand or the emoji hand, or writing your question online here. If you have any questions at all, Shannon McDonald, the Interim Chief Medical Health Officer at First Nations Health Authority, is very capable to take any kind of question you have. So please do ask them before we sign off. And I have a question here. If a person gets the vaccine and gets asked to go back to work, can that person contract and spread the virus still? I think Bonnie Henry talked a little bit about the miracle of that first dose a couple of days ago.
Yeah, we've had some really good evidence come out, both from healthcare workers and from long-term care residents. They started monitoring from day 0, so the day they got their vaccine, and the chances of being infected with COVID dropped precipitously at about day 14. So by day 21, there were no people, the people that had gotten their vaccine, nobody had tested positive for COVID. So in those early stages, the couple of possibilities, they had already been in contact with COVID but weren't detectable on a test, or they hadn't built enough immune response yet. So those first 2 weeks are really important. So if you're called back to work, you have less chance of transmitting to others. But what we don't know, what the science is not strong on yet, is whether or not if I've been vaccinated and I go to work and I come in contact with somebody who has COVID, I may not get sick, but we don't know if I can carry the virus to other people yet, which is why we keep telling people to stay the course, that until we have what we're calling community immunity, it's a tongue twister, I never get it right, or some people call it herd immunity, when about 70% of the population is immunized. Until we get to that point, it's strongly recommended that you maintain those public health measures, keep your distance, wearing a mask when you're in public, anytime you're outside, especially when you're inside in a public place, wash your hands, try to keep your hands away from your face. I'm bad at rubbing my eyes, but hand sanitizer and rubbing your eyes teaches you really quickly that that's not a good idea. So the things we all know, keep to our bubble. Those are tough things to do, but really from a population point of view, as long as we're increasing the number of people who are vaccinated and making sure that people are following the public health measures, we will get to community immunity and stop seeing the numbers spiking. Now, I'm really worried, to be honest. March 17th is coming, and people tend to party on March 17th. Spring break is coming. Easter is coming, and many other cultural events related to spring when people might want to gather. And we saw after the Christmas, New Year's holidays, a real spike in positive cases. So I'm preaching to the choir, I know, But I think it's really, really important that people understand that we have to hang in there with the public health measures to make sure that we all stay well until we get to that community immunity.
I have a question that might seem like very basic or boilerplate for you, but it's a question that comes up from a lot of people in my community who still are vaccine hesitant. And that's something probably you and myself as a journalist have kind of gone over with epidemiologists over and over and over again. But can you tell me about how this vaccine was tested on how many people and how, in such a quick time? I'm still hearing those outstanding questions. How do we know it's safe when it was created so quickly? And how many people was it tested on before, First Nations people got it, for example?
Right. So one of the things that people don't understand is that the messenger RNA vaccines, so Pfizer and Moderna, are both based on a technology that's been around for more than 10 years. It was used to create the new rabies vaccine. It was used to create the Zika vaccine. Remember the mosquito-borne virus that was damaging fetuses in Central America and South America last year, 2 years ago now? I've lost track. Anyway, so, and yellow fever is another one where it's the basis of those new vaccines. So it's technology that we've been at for a while. One of the things that got kicked out in the process was bureaucracy, because God love them. The bureaucratic types aren't always quick to make decisions, aren't always quick to sit down in a meeting to get things done, etc. So the scientists, more than 150 studies were being done across the world, trying to create the best vaccines, and sort of the Pfizer and Moderna rose to the top in terms of the messenger RNA vaccines. In both cases, more than 30,000 people were part of the study. The studies were relatively short-lived though. So that was one of the reasons it came out that they were recommending the second dose at 21 to 28 days, because they didn't have that history. They didn't have the 4-month history to be able to look and say, okay, nobody's gotten sick, everybody's doing okay, they've mounted an immune response. Let's look at how long it lasts. They didn't have that. So now we have more of that information to tell us that people's immunity is lasting for that period of time. And at the end of the 4-month period, you get a booster and you're good to go for a while. We still don't know if a variant's going to come along that doesn't work, but the manufacturers are working on this constantly and making adaptations, just like they do with the flu shots every year. There will be potentially new versions or new booster shots of COVID, but COVID isn't going away. It's here to stay. It will be a part of, it's sort of like polio. When I was a kid, God, that tells people how old I am, I remember lining up at a fire station to get pink drops on a sugar cube. And that was how we got the polio vaccine at the time. And our generation and the generations after have not seen polio in Canada. But I receive notifications all the time that it's cropping up again in Africa, where vaccine processes have not been maintained. So it's not like polio went away, it was how susceptible the population was. So I'm really excited that we're going to have mass vaccination, a good, strong battle with COVID going forward. And then given time, some of those 16-year-olds or 15-year-olds may have to get a COVID vaccine in years to come. But for the most part, we won't see this level of pandemic again, at least not with COVID. And I'm hoping no more.
I think that's a good place to end. And I just want to thank you, Shannon. I know you're an incredibly busy woman. So we're really grateful to have had you here and answer all the questions. And I want to thank the audience too for tuning in. It's great to see everybody's faces. Yeah, thanks to Phoenix and David as well, our technical crew who put this together.
Thank you, everybody. So make sure, as I mentioned earlier, we have our town hall on March the 10th at 7 p.m. You can tune in on CBC TV, on radio, on our app, GEM app, or online, so wherever you can tune in. Thank you again for joining us.
Thanks, everybody.
Thank you.